And at this point, John Kaiser is going to come up and kind of talk a little bit about the differences between the two. John?
See if I can do this without see if I can do it without my glasses here. I got near vision, but I don't have distance vision. Good morning. What's happened over time is Paul's done this presentation. He can do it in his sleep, and but as insurance has gotten more complex, example of Medicare Advantage versus the Medigap, we've gone in and done a deeper dive, and so that's why I come up behind Paul, who introduces the subject and try to give you more detail on that. And that's what I'm going to do now. There is a pass out, you can, like 10 pages on this that you can take with you. We'll have it for you. And of course, this is all going to be on the website, both the pass out information and the video. So let's get into it. So once you've enrolled in Medicare, you need to decide what you're going to do as far as additional coverage, since Medicare only covers 80%. And that's the approved amount for services at participating hospitals. That kind of alludes to what the question just was. The keywords there are participating hospital services and doctors. And as Paul mentioned earlier, you can refer to the Medicare and You booklet. When I first started looking at insurance and I got signed up, I said, well, where's the detail of what's covered? Well, the detail of what's covered is what Medicare covers. If Medicare covers it, the supplemental insurance covers it. So you won't get any detail of what it covers. And the Medicare and You book is very detailed, and it's well worth a read. Your choices for insurance to cover the remaining 20% are Medicare Advantage plans and Medigap plans. They're also called supplemental plans. You're also going to need to enroll in Medicare Part D. Now, if you have an Advantage plan, it includes Part D. And there's very few plans that don't include the D, the drug coverage. However, if you're going to enroll in a Medigap plan, then you're going to have to get a separate Medicare Part D plan, which I'm going to present detail on after the break. And for 2022, as Paul mentioned, the monthly premium is $170.10. That's deducted from your Social Security payments. Or if you delay signing up for Social Security, you're going to have to actually send that payment in directly on your own. But if you're on Social Security, which people are generally at 65, but not necessarily, then it's automatically deducted from your Social Security. For 2022, Medicare Charge is deductible for Part A services in the hospital of $1,556, and that's for each benefit period. So that means if you went in the hospital early in the year and then back in again later in the year, you'd incur that charge again. Medigap policies, I'll get into that, generally cover that, and Advantage plans may or may not. For Part B services, there's an annual deductible of $233. And this is in addition to the $170.10 you're already paying in that Part B premium. So you got two pieces there. Everyone's paying the $170.10, and then the rest is determined by which type of plan you take. The type of plan and the coverage determines how these Part A and B Medicare deductions get paid or are covered by the policy. So the policy is going to dictate what's covered, what's not as far as these deductibles. And again, as I mentioned, it's important if Medicare covers a service, then a Medicare Advantage plan or Medigap plan covers the 20%. But that amount is dependent upon the plan you choose. It's not necessary for the spouses to have the same insurer. Many plans offer a household discount if both spouses are insured, not necessarily the same insurance company, but if both have insurance. In some cases, if they're both an insurance company, that's also can be an additional discount. Medicare Advantage plans and Medigap plans do not cover assisted living or long-term care. So essentially, you're enrolling in a private insurance plan separate from Medicare. So what they've done is, when I say you're not in Medicare, they've assigned 100% of your coverage with an Advantage plan to an insurance company. Whereas with a Medigap plan, Medicare is paying 80 and you're going out and buying supplemental insurance for the other 20. That's the difference. So you're not with Medicare for the 80% like you do an Advantage plan. You're with a private insurer, which the government is, paying. You're still required, though, to pay that 170/10 premium, regardless which kind of plan you get into. That's a given. One of the huge advantages to the Advantage plan is there are no pre-existing condition limitations. You have guaranteed issue when you first sign up. You also have guarantee issue when you first sign up for a Medigap plan. But the difference in the future is anytime you change in and out of a Medicare Advantage plan, there's no pre-existing conditions. With a Medigap plan, as I'll explain later, you'll get into that issue. You're going to have co-pays, deductibles, out-of-pocket maximums, depending on the MA, the Advantage plan you choose. Out-of-pocket, what that means is, for example, there are plans where the total out-of-pocket for the year is $4,900. So if you have this plan, once you've had co-pays, deductibles, et cetera, $4,900, you don't pay another dime. But hopefully you're betting that you're not going to hit the $4,900 because then you would have been maybe better off to have a gap plan. So it's something you really have to understand and think through. Today, like I said, all MA plans, Advantage plans generally include coverage for Part D drugs. The plans now are mostly including dental, vision, and hearing options, and those options are getting pretty good, which is why those plans are becoming more popular. If you go get a standalone plan because you have Medigap, which does not include those, then it gets somewhat expensive. It's almost cheaper to pay out of pocket than to go get a standalone plan, although you have to look at that. Whereas with an Advantage plan, it is an advantage because they are giving you some good rates for dental, vision, and hearing. And for those who are using those kind of services, that could be a deciding factor. They're also including free wellness programs, which is a gym membership. They're calling Silver Sneakers, but I think there's other gym memberships too. But statistically, very small percentage of people take advantage of those memberships. But they keep throwing more and more bells and whistles at this, and you've seen the advertising on TV. It sounds very, very attractive. The problem is there's some, I don't call it false advertising, but it can be misleading and confusing. And they keep coming at you like, Joe Namath. I called Joe up, and I wasn't eligible for a lot of the stuff he was mentioning. I didn't get Joe. Many plans now include free in-home care and transportation and other benefits. And again, there's an example where they throw that out there, but you got to meet certain criteria. You got to have certain conditions, medical conditions, in order to get that. And they even talk about giving you back your 170/10, but you got to be very low income for that. So again, you got to investigate and understand it. Now, some MA plans actually have a zero premium. There's a very good one with ARP that has zero premium, but their deductibles, co-pays, and out-of-pocket maximums, they may be higher. That's what you got to sort out. But zero premium is something to think about. And I'll get into the issue, though, of if you're getting into a position health-wise where you're hitting that $4,900, and now you cannot, because of medical underwriting, and I'll explain that again later, I'm jumping ahead of myself, you can't switch. So you get yourself caught where you got to stay with that particular plan just because you can't switch. You can choose an MA plan based on the type of healthcare services you need and their frequency. So I'll go into those choices. Pricing is not based on age, it's not based on sex or health. And as a rule, higher premiums generally mean lower out-of-pocket costs. Your choice in an MA plan determines your coverage and your costs. Out of state or remotely in a part of a state can mean out of network, depending on the type of MA plan. But there's plans now that let you move out of network even. So there's, you know, it is changing. It's important though, if you like to travel, you want to make sure you go down to Florida, you're not out of network because of your plan. That's something you need to know up front before you go getting into that kind of a plan. Some newer plans charge the same in and out of network. I just said that. But also, there have been a lot of complaints about Advantage plans. There have been complaints that they're denying medically necessary claims and pre-authorizations. I don't know that firsthand, except that's what I'm hearing and reading. And that sounds a little scary that you get this plan and all of a sudden it's not the coverage you thought you had. Again, you gotta look into that. And they, of course, they've been accused, I mentioned already, of false advertising in terms of deceptive advertising. I won't say false advertising. So after your initial enrollment in an MA plan, you still have 12 months to change your mind and go back to original Medicare with guaranteed issue. In other words, there will be no underwriting conditions regardless of your health. If you took the plan out, the caveat there, though, is there are only certain times of the year you can get in and out of Advantage plans, essentially from October 15th, and then you have the first part of the year where you can get out. So from October, so let's say October to March, where you can get in, where you can't get in the first quarter, but you can get out. And so you could change your mind after a year, particularly if something happens serious with your health. After age 65 or when first eligible, you can join or switch plans during the annual election period. That was like one question. So every year between October 15th to December 7th, you can change Advantage plans. If you're first enrolling, you can enroll now. You don't enroll in that period. These are for folks who are already in the plan after age 65. You can also change plans during the open enrollment period, which is January 1st to March 31st of each year. You can disenroll from your plan. You want to move to a Medigap plan. You may be subject to underwriting if it's been more than a year. Or you can change to no plan. You can just have no plan. You take on the 20% yourself. I don't think people generally do that. However, you cannot move from a Medigap plan to an MA plan. So if you're in a Medigap plan, you cannot sign up new to an Advantage plan. That's not an enrollment period. That has to happen between October and December. It's a little bit confusing, and that's why you may want to reread what I wrote and pass out. With MA plans, you'll receive only one billing from the insurer. You don't get billed by Medicare. It's not a big deal, but it's just one billing because, again, they're covering 100%. So here's some detail on the different plan choices. The least cost is an HMO plan. It's, like I said, least cost will limit you in terms of providers. Your primary care must be in your network, and only they can refer you to a specialist also in the network. Except in an emergency, it does not cover services outside your network. Not a good plan if you travel frequently, because again, you got to make sure you got coverage when you're out traveling. An HMO point of service plan is like an HMO, except you can be seen by providers outside your network. Primary care doctor does not need to be in network, but a specialist or hospital out of network will cost you more. So you can go out of network, but you're going to pay more. The PPO plan, which is the most popular because it has the more flexibility, but potentially higher cost too, has more flexibility but higher cost. You can go to any primary care doctor or specialist, but pay less if you stay in your network. Network providers can bill no more than negotiated fees. There's a larger network of providers, so more chance that if you went outstate, you'd be still in their network. Threw this chart in just to show you what's going on with the Advantage plans. You can see the huge growth of people choosing, you know, it's up to what, like 48% now, where people are choosing Advantage plans. And again, that's because of all the bells and whistles in there. And there's nothing wrong with the Advantage plan, except that you've got to be careful in terms of co-pays. It really depends on your health. And my personal opinion is if I can afford the Medigap plan, I'm going to go with that because, as you'll see when I explain it, it's pretty simple and straightforward. Advantage plans, you better understand what's in and out. And one thing I'll mention later is you got to make sure when you get an Advantage plan, you price your drugs because that drug cost could drive. You may think you're getting a low premium, but your drug costs within the plan could be higher. Sorry, it's so complex, but it is. So I already mentioned the Advantage plans. Let me talk about Medigap plans. Again, Medicare pays 80%. A Medigap plan is a private plan designed to cover that 20%. Plans available today do not cover the Part B deductible. There was a F plan that went away for those who weren't 65 as of January 2019. Those plans did cover that 233, but unfortunately, those plans are getting more expensive because the only people who are still enrolling are getting older and the usage is higher. But the plan you can get plans today. Any plan you get today is going to require you to, at a minimum, to pay that $233 upfront in each year as a deductible. I'll explain more about the different plans in a few minutes, but they don't cover, like I said, they don't cover the $233, which is upfront. At age 65, when you're first eligible to enroll, you have guaranteed issue, meaning pre-existing conditions do not apply. After your initial enrollment in a Medigap plan, you do have 6 months to change Medigap plans, as Paul said, without underwriting or guaranteed issue. Unless you enroll at age 65, or when you are first eligible to enroll, the insurer may deny you coverage or charge a higher premium due to pre-existing conditions. If you want to enroll later in a Medigap plan or change your existing Medigap plan, you may be subject to what's called underwriting. And let me explain that. Medical underwriting is a review of your medical history. You are required to answer a series of medical questions, including a discussion of the prescription drugs you take and why. So they ask you what your scripts are, and you tell them you're on Eliquis. Well, right away they're going to ask you about AFib. So your drugs kind of drive the questions. And do you have any pending surgeries? The doctor said you need the surgery and you haven't done it. These are kinds of things that would disqualify you. But again, if you're signing up for a Medigap plan at age 65 or when first eligible, because maybe you don't have to sign up yet because you or your spouse are still working, you don't have to answer all these. But if you try to get into a Medigap plan later on, after that year, then you're going to be, or 6 months, excuse me, you're going to be caught with having to go through underwriting. And I'm 79, I'm still passing underwriting. If I find a cheaper plan, I switch. So it really depends on your health. Really depends on your health. Certain conditions related to the heart, cancers, etc. Cancer is a big one. And pending or recent surgeries can disqualify from changing to Medigap plans from an MA plan from your current plan to another Medigap. That's what I just said. That's why it's so important to make the best choice for yourself when first eligible to enroll with the guaranteed issue. It's possible to enroll in a Medigap plan by paying a higher premium due to certain medical conditions that would otherwise disqualify you. Smoker, for example. I'm not sure of the whole list, but there are certain medical conditions that say, yeah, we'll give you a Medigap plan, but you're going to pay more. Medigap plans have no open enrollment restrictions. You can change plans at any time. So there's no open, closed periods anytime. Again, though, you got to be, if you're in an Advantage plan, you got to be able to get out of it. However, if your health deteriorates, you may not be able to pass the underwriting in later years. That's the key. You could enroll also in an Advantage plan during your open enrollment period. So if you really, well, I don't know how many people would go from Medigap to Advantage plan, but you could. What's happening too is, you know, the guys are getting up in their 80s and they're paying $200 and $300 a month for a Medigap plan. Medigap plan will climb on you every year, as will Advantage plan, but maybe not to the same amount. So Medigap plan coverage is determined by the plan codes, which Paul mentioned. Uh, they're standardized among insurers. So if you're with an insurance with a given code, that dictates the coverage. There's no, and again, back to if Medicare covers it, then the supplement covers 20%. This means every insurer-specific plan code has the exact same coverage. The plan you choose will determine your premium and copays. With Plan F gone, Plan G is probably the most popular, and the only payment with a Plan G is the $233 up front. So you pay $233 up front, you don't pay a dime the rest of the year, not a dime, provided it's a Medicare covered service, which is pretty broad, but you can't go getting cosmetic surgery or something, you know. So in the other plans, though, they have higher copays but lower premiums. The N plan, for example, is kind of a neat plan for some people. It's, I think it's $10 a doctor visit, $50 for emergency room, and you pay that $233. But then after that, you don't pay anything. So if you're someone who goes to the doctor once or twice a year, you could get an N plan, and you'd have to look at the difference between the premium of the G and the N and see if it's worth it. And of course, the other thing, if all of a sudden you need more coverage and you want to go to a G plan, that insurer may require underwriting. So for the most part, if the savings is not that great, maybe the G plan. So if you're looking at Medigap, I think the G is the most popular and makes the most sense for most people. Unlike Advantage plans, Medigap's premiums are based on age, based on sex, tobacco use, your health, zip code, and county. Zip code, that's interesting. People up north in Michigan are paying less than we're paying down in the metropolitan area. And they don't cover dental, vision, or hearing. They do cover skilled nursing. Actually, they can cover skilled nursing, from what I'm reading, better than an Advantage plan. And like Paul mentioned, the PT, you don't get the PT covered with the Advantage plan, whereas you get the PT covered with, physical therapy with a GAP plan. So most states allow you to enroll or change Medigap plans at any time. However, if you're in a Medigap plan, or excuse me, an Advantage plan, switching to a GAP plan, you can only disenroll from the plan during specified time periods. That's what I mentioned. Therefore, if you have an MA plan, Advantage plan, make sure you can leave the MA plan before you sign up for a GAP policy. Never cancel, never, ever, ever cancel an existing policy without written proof of your new policy from the insurer. You could have a big problem. I've known people where it happened, and you don't want to do that. You want to be sure that you've got the new policy in place. Medigap plans do not cover Part D drugs. When you enroll in a Medigap plan, you must sign up separately for Medicare Part D, and I'm going to cover that after the break. Or you're penalized permanently 10% of the national average monthly premium cost for each year you're without coverage. So, for example, because that's confusing, if you didn't sign up for Part D for 5 years and you use that would cost you about $20 a month forever. So if you had a premium that it was $20, you'd be paying $40. So it's very important that you get Part D coverage. And again, you've got coverage in an Advantage plan. With a Medigap plan, you got to go out and get the separate coverage. Sign up, if you're not on any drugs, you can sign up for $12 or $15 and now you're covered. Even if you don't have drugs, you're avoiding that penalty. Some people play the game, they don't sign up and they just say, yeah, I'll pay the penalty later. That could be very dangerous if you were suddenly to get a very expensive drug before the open enrollment period of October. All of a sudden you got a very expensive, you could wipe out any savings you made by skipping signing up. Several Medigap plans do cover foreign travel in emergency situations, and there's a deductible. But now some MA plans, Advantage plans are starting to offer it. So they're, again, another bell and whistle that they're adding. So this is a lot to absorb. Again, you want to read the pass out a few times. And it's in greater detail. Well, I've just mentioned that on the website, because the website's going to have the pass out and this video of me making this wonderful presentation. It was a joke. It's labeled Understanding Medicare Advantage Plans and Medicare Supplemental Plans. Like I said, we have a copy. Now, even though I think I have significant knowledge regarding Medicare and Supplement, I would not hesitate to use a healthcare consultant. Because how do you go in there and research the different insurance companies? You're going to go to each insurance company's website, and they can tell you based on your conditions, your situation, and they can tell you who has the best premiums as far as the cost and the coverage, particularly if you're into an Advantage plan. But if you're a Medigap plan, they can get you signed up. There's no fee from them. Any commission they get is from the insurance company. And again, Howard's going to put up a slide later. I think it has the information on our consultants, and it's also on the agenda. So that concludes that presentation. I hope it wasn't too confusing. I'll take questions though. Wait for the microphone.
I have a question with regard to deductibles.
Yeah.
Are the monthly premiums part of the deductible?
For which type of plan? Advantage plan?
Well, you made a comment that the Part A was 1,556 for
Yeah.
the MA.
Yeah.
And then you said for Part B, it's $233.
Well, if you
and
sign
then
up,
you said
okay.
that the deductible was $4,900.
Well, no, I'm sorry, I'll explain it better. The 1,556, you won't incur with an Advantage plan until you go into the hospital. They can charge you like for the first 5 days, generally speaking. So that the risk there is stay out of the hospital. No. With a gap plan, that 1,556 is covered in most plans. Bart? No, the 233, you're gonna pay the monthly premium, and then when you get started in January, when you go to the doctor and there's a $25 copay, you'll get charged the $25 copay until you hit 233. Once you have paid 233 for the year, you pay nothing more under a gap plan. The Advantage plan structure is totally different. There's copays or deductibles. They don't call out necessarily the A or the B. They just have copays and deductibles with a maximum copay deductible of $4,900 for the year. In that example, there could be a plan that has a lower annual or a higher annual depending on the plan.
So by the time you pay the 170.10 for your MA, if you multiply that by 12 months, you're at 2,041. So my question is that MA 4,900, does it include those
no,
premiums
the
you paid?
170.10 is whether you get insurance or not. Yeah, that's a Medicare charge.
Oh, so it has nothing to do with
Just
MA.
to be in Medicare. Yeah, it has nothing to do with it.
Okay.
No, I'm sorry. No, it does not count towards the 4910. The other stuff I talked about, those deductibles, they do count towards that. Yeah.
Okay, thank you.
I know it's very confusing. I hope I answered this. Yeah, I got a couple more. Oh, yeah.
So from a billing standpoint, I'm 66 and change right now. And I'm not on Social Security. So I'm getting billed regularly for, Medicare. Once I go on Social Security, does that billing then switch over to being deducted directly from my Social Security check?
Mm-hmm.
Okay.
Yeah. Correct.
This is a narrow question concerning the F plan, which we're
The
old enough that we
F
have
plan?
the F plan.
Okay.
Yes.
Mm-hmm.
The last time we got glasses, the optometrist office said you have coverage. So somehow or other we got some benefit. This time when we looked into it, they've come out now with an F plus plan. Will there be anybody here that can address that F plus plan, because my consultant is not familiar with it.
Mhm.
And what it does is it pays something, and I don't know what, towards glasses and dental. But it's
Okay,
an
I'm gonna
additional
ask
charge.
Dave in a second, see if he knows, but Dave Butler with Butler, but,
But if it could be
under-
covered later on, that would be great.
okay. Well, but understand, when you go to the doctor for the examination for your eyes annually, Medicare covers that. What they do not cover is when they doing all this, pick one, pick two, pick three, and give you a script for your glasses. That they can charge anywhere, well, I'm paying $50, some people pay less. So Medicare does cover, without any insurance, without any supplement, that Medicare does cover the basic eye exam. What they don't cover is some of these advantage plans is getting glasses. But
Want Dave to answer?
Dave, you want to comment on the F plus? I'm not sure what it is, that's why I don't want to. Who's your insurer?
Yeah, so what they're doing right now is some of the plans, the Medicare supplement plans, and what they're doing is they're adding vision to them more now, but it's a plus plan. So you normally have to purchase that. So let's say you pay $175 for F. They might offer for $28 for you to pick up dental vision or a combination of dental vision and hearing. A lot of them are starting to add it, and then they'll tag on $28 or $36 to your plan. And then you can pick them up. It's becoming more and more popular because they're trying to compete with the advantage plan. No.
Yes.
Well, not even the Medigap, because remember, Medigap plans, like that will cover the eye and hand, but it won't cover any materials, lenses, frames, things like that. But if you pick up the plus part of it, it's a separate piece that is a dental vision option, and it is a network option. So you've got to be careful. Like if you were with, let's say, our UHC, and you picked up that plan, it would be a network plan. You would want to look and make sure that your doctor and facility is definitely going to be in there for the vision of dental. So they're starting to add just like advantage. And every carrier is going to be different.
Give her a mic.
I should be able to get an answer from my enroller after October 15th.
No.
Working with. Sorry, it turned it way up. But anybody that you're working with, you should be able to ask them, what are the different options? And again, it's carrier by carrier. Not all the carriers are offering the add-ons.
Okay, very good. Thank you so much.
Mm-hmm.
So, go ahead.
Question on consultants, which seem like they would be a key to help you with your personalized decisions. Consultants were no cost, correct?
That's right.
And is it possible that you could go to more than one consultant and see if you get similar input from multiple people?
Well, yeah, but as a comment, we've got consultants that were listed here, and Dave is one of them who's here today. And sometimes more of them can make it, but today we have Dave, which is great. But we list them on our site. But that's not to say you can't go to other consultants. That say a friend says, I got somebody I really like as a consultant.
That was
My only point is you can go to as many as you want.
Got it.
You're taking up their time.
That
but,
was the question.
yeah.
The follow-up to that is, were there any certain criteria for the consultants that you guys have recommended to us? Did they have to go through any kind of validation to make this small list?
Well, we vetted them from the perspective of what our retirees has given us as feedback of the services. Dave is actually in Ohio, and that emanated from the fact we had Toledo plants down there, and he was servicing our retirees down there and doing such a great job that we've opened him up. I mean, today you don't need to drive to Ohio to deal with them. They're even opening up enrollment online. So he's just one of several. Then we have, again, I'm getting ahead of myself because Howard's going to introduce them, but we have some that are local, and we have another person who's in Austin, Texas. It just doesn't matter. But to answer your question, you can go to several. They're going to have the same quote for the same insurer, but some may be licensed with more insurers. And I wouldn't think so, not from our experience. Go ahead, Dave.
To your question, oh, there we go. You can work with as many brokers as you want to, and you may get different, options and ideas and products from everybody else. When you're doing it, you want to try to find someone to work with that represents a lot of products. Like John said, we're in Ohio, actually. We're in Perrysburg, Ohio, but we come down here all the time, and we're actually licensed in all 50 states. We don't sell every single product, but we do sell the majority of the products. And if there is a product that you are looking at out there, we can get licensed mostly with almost all the companies and find out the information for you. But you can check with as many different brokers as you want. You may get different answers.
One thing that's new is you can go to Medicare.gov and ask to see Medigap plans. And there's a list with pricing for G, whatever letter you want, with all the pricing. And then you call someone like Dave and say, hey, can you sign me up for this plan? You can do it that way too.
Okay. Let's see. I got, I think, 4 questions, and somebody just added one, so I need to move up. How long does it take to get your Medicare card after you've applied? And this individual is not on Social Security yet. So he hasn't activated Social Security, but he's applying for Medicare.
I'm sorry, I don't know how long it takes to get the card. You'd know, Howard.
Well, I answered his question because I had that experience. I wasn't on Social Security. I applied 3 months. I sent my application in about 3 months before my birthday, and I had my card without any trouble before my birthday. So in that regard, it's pretty straight. I think it's pretty straightforward, but I wanted to make sure
Okay.
I asked you guys.
Okay.
How is Medicare coverage affected by veterans with Tricare coverage? He's a Chrysler retiree, but his spouse is a U.S. Army retiree.
What I've learned is that the Medicare, the drug plan, the Part D, is less expensive if you're a veteran, if you want to go through that. I don't know about the Medigap plan. Dave, do you know the Medigap plan for a veteran?
Yeah.
Good thing I got Dave here today.
Yeah. My dad actually has Tricare, so you can have all the insurances. You can have the Tricare, you can have the Medigap plan, and you can have the Part D. You just basically you're going to have to give them all 3 cards. But a lot of the medications could be covered better by Tricare on that card than they will by the Medicare Part D plans. It just all depends, but you can use all 3 of them.
And Tricare is credible coverage.
Yeah, Tricare would be credible coverage.
So you don't have to do a Part D.
No, you don't have to. Yeah, if you have veterans coverage, you don't have to take the Medicare Part D plan at all. Yeah.
I guess the bottom line is they should investigate both.
Yeah, and I think that's a good suggestion is no matter what, ask. Find your consultant and ask him to double check.
Yeah.
Medical provider takes Medicare, but not assignments, which I believe means I have to pay the account balance above what Medicare and my gap does not.
Yeah.
How do you know if a provider accepts the amount Medicare and gap pay as a total payment?
Unfortunately, you got to ask them, I think. I think the F plan was covering the excess. But the F plan's not there anymore unless you were 65 as of January 2019. Just say, the answer is ask them up front.
Gotcha. The last question is about the presentations being online, and I don't think yours is out there yet, John. Paul, have you sent all of them to,
No, mine's there. Mine's there not as a speech, mine's there as 14 pages of words, which is a pass out here.
okay.
So the same pass out I have here is available online right now.
Okay. Yeah, I know yours is there. I got somebody that asked about that. So that's all I've got from the web.
I have an appointment with a gentleman named David Benet at Oakcrest, and when you look him up online, he's called a licensed insurance counselor. What does that indicate? And do the people here, are they licensed?
Be careful, make sure there's no fee involved.
There is not.
No, I don't, other than his reputation, I don't know that would be a problem. I mean,
So what about the licensing? Are the people in the room
well, no,
licensed?
David's licensed. They're all licensed. Everyone has to be licensed. They have to take annual exams, everything.
Okay, thank you.
Yeah, you can't, Dave says you can't sell a product without being licensed.
I just keep that here. Okay, so besides having a license, you have to be licensed in every state, and you have to be licensed with every company that you represent. And now, which has gotten really crazy, is you have to take an exam every single year to be able to sell the Medicare products, and then you have to take a test by product, by company. So it's about 30 days of testing just to be able to sell. And because we sell so many companies, we're taking tests with every single one of those companies because they want to make sure that we understand and know their product. That's why I was saying earlier, if you go with someone that might sell one or two products, they've tested with those two companies, but they, give you an example, they might only represent Blue Cross Blue Shield of Michigan, Blue Cross Blue Shield of Arizona, where we represent Blue Cross Blue Shield in almost every state. So we're a little different. We tried to, part of what we were doing with Chrysler was that we wanted to bring as many products and many states to the organization that we possibly could, because when you retire, people are moving all over the place. We have tons of people down in Florida, Arizona, California that have just moved to warmer climates.
Any more questions?
Okay.
Okay.
Well, you can ask them later too, so.
Thank you very much, John.